What has been the impact of the Affordable Care Act on healthcare access, cost, and quality? By Felicia, Benita, and Shanae. This presentation assumes all Americans will need medical treatment at some point throughout their lives. The Affordable Care Act is a healthcare model structured to ensure the health and well-being of every American, regardless of ethnicity, income, age, or other socio-economic status. This act was established to achieve nearly universal health care. During this presentation, we will cover the following: the need for the Affordable Care Act, the newly covered, the ACA's impact on Medicare and Medicaid, premiums, among others. The Patient Protection and Affordable Care Act, otherwise known as the ACA, but most commonly referred to as Obamacare, was signed into law on March 23, 2010 by the Honorable Barack Obama. One of the major coverage provisions of the Affordable Care Act is the expansion of Medicaid eligibility to nearly all low-income individuals with incomes at or below 138% of the federal poverty level. Creation of health insurance exchanges, which allow non-insured individuals to purchase insurance with premium and cost-sharing credits. We must understand the uninsured are less likely to receive preventative care and less likely to seek care as quickly when they are sick or injured. This results in higher cost when they eventually do seek treatment. In addition, nearly 40% of the healthcare cost of the uninsured are passed on to consumers who do have coverage in the form of higher premiums. Those that are newly covered by the ACA are young adults between the ages of 19 to 25 that are eligible to be covered under their parents' policy, and adults between the ages of 19 to 64 with an income up to less than 133% below the federal poverty level. Also covered are those that have a lower income, are less educated, and the more ethnically diverse patient populations. On average, single adults with a median age of approximately 33 are those that are greatly covered. Coverage is achieved via health exchange. Health exchange is another term for health insurance marketplace, which is a service available in every state that helps individuals, families, and small businesses shop for and enroll in affordable medical insurance. This is a service available for those that do not have health insurance through a job, Medicare, Medicaid, the Children's Health Insurance Program, otherwise known as CHIP, or any other source that provides qualifying health coverage. The health insurance marketplace was established to encourage competition and patient choice. The ACA expands Medicaid coverage to low-income earners and qualifies these individuals' medical coverage without waiting for a disability determination. The ACA has increased Medicaid enrollment by more than 15 million and created a benchmark that includes the minimum essential benefits. The enactment of the ACA has increased funding to help ensure that every American is able to receive long-term care, services, and supports in-home or community care. It extends authority to the Children's Health Insurance Program through the fiscal year of 2019. As you'll notice, over 1/3 of American children are covered by Medicaid or the Children's Health Insurance Program. Insurance companies must now spend at least 80% of insurance on premiums on medical care and improvements. The ACA also aims to prevent insurers from making unreasonable rates increases. Insurance coverage isn't free by any means, but people now have a wider range of coverage options. To reduce premiums for high-risk individuals, being that they do not have to pay high-risk related premiums based on poor health, along with a decrease in gross premiums based on tax considerations. And according to the HHS, 72% of consumers using healthcare.gov found plans with a premium of less than $75 per month, and about 77% found plans with premiums below $100, taking into account financial assistance received. Social Security and Medicare were originally enacted more easily and with a modicum of bipartisan support, because in 1935 and 1965, Democrats not only controlled the White House, but had an overwhelming majorities in both chambers of Congress. In contrast, Obamacare barely made it through Congress in 2010, given thin Democratic majorities. Amid extreme partisan divides along ideological lines, it faced all-out Republican opposition. By extending health care coverage to new, underserved groups, the ACA squarely responds to concerns repeatedly raised by international human rights bodies and experts about racial disparities in U.S. healthcare policy. Remembering, balancing between ensuring near universal healthcare coverage and respect for individual and state rights are paramount in seeing this enactment live up to its full potential. In order to create stability within the insurance market, political acceptance, human rights, and balance must be taken into consideration. Again, the ACA is perfect by no means, but there are many benefits that will stand to strengthen this program. Benefits such as ensuring that every child under the age of 18 has health insurance coverage, regardless of the socio-economic category of their parents. The NIH funding to keep pace with the GPD. And all healthcare treatment facilities must be accredited by the Joint Commission. Also, allowing employed parents greater access to the new marketplaces and allow employers greater flexibility to offer or not offer health insurance coverage. Offer what's considered as public option early Medicaid coverage within health insurance marketplaces to people over the age of 60. Knowing and understanding all of this, we gather that the repeal of the ACA would mean more than 20 million Americans would lose health care. About 27% of adult Americans younger than 65 have health conditions that might lose their coverage in the individual market. Rural hospitals may be in severe disparities as well. Removing this provision would remove free testing for tens of millions of people. If people are less likely to get these tests, they may seek medical treatment only when they are more seriously ill and use hospital or emergency services as a last resort. The ACA will not solve all of the problems concerning healthcare and its expense overnight, but it is an important step forward. By making health coverage more affordable and accessible and increasing the number of Americans with coverage by funding community-based public health and prevention programs, and by supporting research and tracking on key health measures, the ACA will begin to reduce disparities, improve access to preventive care, improve health outcomes, and reduce the nation's health spending. The Affordable Care Act provides one of the largest expansions of mental health and substance use disorder coverage in a generation. By requiring that most individual and small employer health insurance plans, including all plans offered through the health insurance marketplace, cover mental health and substance use disorder services. Also required here are rehabilitative and habilitative services that will help support those with behavioral health challenges.